We are recording this webinar. And so just so that you know, just some ground rules here, please submit your questions or comments via the chat. And we are giving one CPE that's available. And so there are 3 polling questions, there are actually 4, but you need to answer 3 of them during this presentation and stay for the duration of the webcast. The CPE certificates will be emailed to you within 2 weeks. And at the end, also that you'll be getting a survey regarding this webcast. So welcome and thank you very much for joining us. I'd like to start by having Joni Noel introduce herself, and then Mike, and then we'll go ahead and get started with the agenda and content. Joni? You're on mute.
Sorry, I thought I went off mute. Thank you, Kenan, and thank you everyone for joining us. I'm Joni Noel. I'm the global leader of our healthcare and private equity verticals, and healthcare is our largest industry vertical as a company. When we mean healthcare, we cover the whole ecosystem. It's life sciences, it's payer, it's provider, and healthcare support companies like distribution companies like McKesson's of the world. We partner with 80% of the Fortune 50 healthcare companies, 75% of the top healthcare systems, 100% of the top 10 pharma, biotech, and med device companies, as well as 60% of the rest of the Fortune 500 life sciences, 55% of the Fortune 1000 payers, and we also plenty of academic medical centers. As well as startups. So we're not just only focusing on big companies. I've been with RGP for 24 years and I love it. So thank you, Kenan and Mike. I send it to you.
Thanks, and thanks, Joni, and thanks, Kenan, for facilitating today. Thanks, everyone, for being here. I'm Mike Rosenbaum. I'm the founder and CEO of Arena. Arena is an AI platform that's applied to healthcare workforces that's based on the idea that you predict the likelihood that each individual will achieve an outcome in a job. And then the use case is primarily enterprises using it to figure out how to improve retention and otherwise optimize metrics inside their organizations. And we're in 1 in every 7 healthcare employees in the United States, so 2.8 million people out of the 20 million people who work in healthcare in the United States. And that number today is increasing by about 600,000 people a year.
Great. Thanks, Mike. So everybody, the agenda today, so we want to first establish a framework and a background on where we're going to in this conversation. So first one is what's happening in healthcare in general in the hiring economy, and then moving on to some definitions and the dynamics around this multi-generational workforce that we're working in right now from employee's point of view, an organization's point of view, and then the rewards and compensation around that. And then lastly, we're going to tie it all together with the impact of the AI, the technological advances, and weaving it in regards to hiring. So with that said, Joni, could you start us off with what's happening in healthcare?
Sure. There is more movement across industries. 54% of Americans in the labor market would change industries if they could, and that's including in and out of healthcare. Unprecedented speed of healthcare workers' transformation since 2019 due to higher turnover, more unfilled roles, and shortages of talent. Increase in need for healthcare employees driven by demographic and other factors because of aging population, burnout, and post-COVID strain. Growth of independent workforce, 36% of the US workforce no longer wants to work for a single employer, up from 27% in 2016. So gig workers is on the rise. Embrace of work from home, at least 1/4 of Americans now do it, and they want to keep doing it. Broader range of ages in the workforce, as we are going to talk more about really the generational differences. By 2026, over 45% of healthcare workers will be gig or consulting workers.
Great. Mike, is there anything you want to add to that before we go to your slide, the next one?
No, I just want to underscore Joni's point about 54% of Americans saying they would like to change industries if they could. You know, I think in healthcare, we talk a lot about burnout and we talk a lot about worker shortages. What we don't talk as much about is the opportunities that the disruption of the last few years in workforces has created to draw folks into healthcare jobs, and how we think about doing that as a way of addressing some of the concerns that we have on healthcare workforces.
Yeah, great. Thank you, Mike.
So To that point, this is actually data from Arena's platform for folks applying for jobs in post-acute and senior living jobs. So at the beginning of 2019, we saw 48% of folks applying for those jobs not having prior experience in the post-acute space. By 2023, that number was 62%. That is a massive change in an incredibly short period of time. And this is not just sort of a fluke based on a small data set. This is based on 740,000 people applying for jobs. So we're talking about a significant number of people applying for jobs, and we're seeing a massive increase in the percentage of people interested in coming into the space. The question becomes, how do I identify someone who may not on paper look like they would be fabulous in healthcare, in a caregiving role or some other role, and doesn't necessarily have all the skills? And how do we identify the individual? And how do we create a mechanism for someone to develop the skills to move into that job?
Mike, I want to jump in on that question really quick. What you were talking about, the movement. Have you seen any kind of trends that point like more people in healthcare are coming from, because healthcare is so highly regulated, are they coming from financial services, or are they jumping out of tech and trying to go into somewhere that is secure in healthcare because there's always going to be a need? What do you have any sense of that?
So we get some threads of it. And I think that when you look at the post-acute space specifically, folks who have been in jobs where they interact with other people. So you think about a retail job, or even a job in a quick service restaurant. So Arena was deployed into the largest franchisee of Taco Bell, Arby's, and Applebee's and Panera. Mm-hmm. And so being able to identify someone who may have been working in a Taco Bell, who would be an incredible CNA. You can get a CNA license pretty quickly if you have the sort of, the makeup for it. Who could be a great CNA and then over time become an LPN or an RN. We see that at pretty significant scale. The other bucket we see, particularly in certain geographies is, and this may seem a little counterintuitive, but folks who work in Amazon distribution centers. So someone who works in an Amazon distribution center may be working there for compensation reasons, and it may be sort of the beginning of a career, but doesn't actually have a mechanism to move out of the Amazon distribution center into a job in healthcare. And there are a whole range of jobs in healthcare. I mean, we sort of talk about RNs, and RNs obviously are sort of limited in a particular way. But the question is sort of, what are the jobs that don't require quite as much time to develop the skills and licensing? And because Amazon has such large recruiting budgets, they draw a lot of people into those jobs who may not be happy in them because what they really want is to be interacting with another person.
Those of you who are attending this webinar, I had the pleasure of working with Mike to prepare for this webinar, and some of the stuff that he was sharing with you, he had shared with me, and it was just shocking to me, just the idea, right, of taking a retail worker. But then when I think about the CNA licenses and those kind of different type of certification opportunities that you could have, that to be able to move those kind of over. So it's not necessarily, what I heard you also saying is like, it doesn't necessarily have to match with, well, financial services has a lot of transactional volume and is highly regulated. And that's kind of what healthcare is. Lots of volume, highly regulated. That's not necessarily the formula is per se.
Totally. And then the interesting part, obviously, someone can move into a CNA job pretty quickly. I mean, there was a period of time a bunch of years ago when Walmart was actually one of the largest employers of CNAs. And the reason why Walmart, it was not actually for healthcare related work, it was for retail work, because Walmart was paying more than healthcare was often paying for those jobs. But then someone would sort of hit a ceiling and would be interested in leaving and sort of finding a way up. And so the task for the healthcare employer becomes, okay, how do we identify the person? How do we find them? How do we identify them? And then how do we say, okay, X person's going to come back and they're going to work as a CNA, and that's fine, and that's important. But actually what would be really great is if I had an LPN in 18 months. And what's the mechanism to do that?
Yeah. Later on in this presentation, everyone, we're going to talk about what it's going to take to do that kind of activity. So thank you for digging into that a little bit, Mike. So with that said, we're in our first polling question, everybody. Let me go ahead and launch the poll. Is your organization investing in AI? Wait, actually, that's not the right polling question. It got moved around. So and we'll ask this question now. Is your organization investing in AI? We're going to have the AI conversations towards the end, but let me, if you all could answer this question, no, or yes, we're beginning. Yes, we've identified the operational and clinical areas. Yes, we've started our implementation process of certain areas. And yes, we've already in and we've seen the benefits in AI. Have a couple more people answer this question. Great, thank you. So if you could look at this, the results of this polling is there's a lot of no's, right? And I think even, Joni, you could probably even comment on this, and even some of the AI discussions that we're having is people are still trying to figure out what is AI in these conversations.
Right, and governance around it, and really AI is part of a overall data strategy that you need to do. Some people are really scared of AI. They're just touching their toes in it. Maybe they're using it for onboarding of HR. We've seen some clients do other things, as well as we've seen some really clinical uses for this, like in cancer center, that they are using it for different access to different clinical trials and knowing what other trials are out there and getting a positive outcome. But there's all different kinds of uses, but it really, I know people are nervous about it.
Yeah, got it. Thank you. So moving on, we're now moving into, now that we've talked about what's going on in the environment, let's talk about the definition and the dynamics of this multi-generational workforce. So Joni?
Sure. Now the 5 generations in the workplace, you all can identify with one of these because you're all one of these. But just a reminder, the traditionalists are I'm not going to say what years they were born, but their workplace loyalty, the hierarchical management, prefer face-to-face, slow to change, and technically challenged. Baby boomers are motivated by occupational prestige, want recognition, thrive in traditional environments, and technically challenged as well. Gen X's really seek work-life balance. We all have Gen X's. Either they might be our kids or it could be working with them. They want independent work style, welcomes change, and analog to digital generation. Our millennials, they're very entrepreneurial minded, instant gratification and recognition, free thinking, creative and collaborative, civic oriented, open to change, and tech savvy. And then the Gen Z is the newer group, pragmatic entrepreneurs, innovative, social activism, accustomed to change, and fully digital. So hopefully you see a little bit of yourself in whatever bucket you're in, or maybe this is exactly you.
So you guys, we wanted to presence this because we're going to build on top of these generations as we talk further in this discussion. So with that said, what group are you in? Let me go to this poll, launch it. Which group are you in? Traditionalist, baby boomers, Gen X, millennials, Gen Z. Great. Thank you. That was an easier question. We got a lot of responses very quickly. Thanks, everybody. So in the room today, we have a very, very good mix overall, but mainly the Gen X there, right in the middle, surrounded by baby boomers and millennials. Okay. Joni?
Sure. To strengthen attraction, engagement, and retention, it's really important to act across these 3 pillars we're going to talk about and really harmonize, the differences that you have on the multi-generational. So employees want meaningful goals and executable. They want autonomy. They want workload balance and work-life balance, flexibility, teamwork, and empowering managers. Organization wants social purpose, leadership that inspires and elicits trust, innovation, digital technologies, transparent, diverse, and inclusive culture, sense of community, and financial performance, and obviously positive margins. And for total rewards, fair and competitive pay across all those generations, many choices, and they want them to be customizable, generous benefits, and learning and development opportunities for them. And I mentioned that we need to harmonize across all of these. So we're going to go in a little bit deeper on enhancing the change for employees. So what are some things that you can do to help? So to optimize workflow and reduce work, really figure out how you can reduce or automate certain tasks. They don't want to do low value tasks. A lot of generations do not want to focus on administrative duties unless that's just their core job. Really, they're very frustrated with the time to hire and how long it takes to onboard. What you could do is shorten your time to hire and really have robust onboarding programs to really help with retention. And then to expand the use of AI bots for documentation, really anticipation of upcoming needs, and for recommendations. So on redesigning work teams, really think about, you've got multifunctional areas, but virtual teams really have expanded in healthcare. Just think about all the video visits you do. Think about care at home that's available to you today, remote medical devices that can monitor and communicate back. So really, it is possible to have more virtual teams doing things. Really leverage data to develop more patient-centric, coordinated, and effective delivery of services. As redesign happens, really challenge your staff ratios and key in on development programs and opportunities, and use AI and data to improve staffing plans, flow, talent pipeline, and workforce organization. Providing flexible roles with flexible shift options, really job sharing choices, we're seeing a rise on that, and help with this by identifying candidates who will be open or even better in different roles or department. Really thinking about cross-functional expertise. So when you look at the baby boomers or the traditionalists, they really have many years of experience, and are you really utilizing all their experience?
Mike, I'd like for you to chime in on this, because one of the things, especially in what you guys do at Arena, is I'm curious that when you get like requests for utilizing the AI for the hiring piece of this, I think this would be a moving target, because some of the things that you said earlier were talking about utilizing people's skills in different ways and really understanding what that is. Do you find that, first of all, from an employee point of view, that it's kind of a moving target as you look to try to hire and retain and or convert employees in the hiring process? Because I think that the role would be a moving target if you're trying to evolve these workflows and process design.
You know, I think one of the fascinating things about the way that technology has evolved in AI and beyond is that we can start to address challenges that have existed for a long time. And when we think about the kinds of stuff that we work on, you know, we're really solving two different problems. One is that I, as an individual hiring manager, may or may not know whether or not someone's going to do well in the job I'm filling. But the other is that as a job applicant, I may or may not know where I'm going to be happy and successful. And specifically, that could show up in as extreme a version as I'm applying for a job in physical security in a hospital. And I'm applying for that job because I know someone else who has that job. And so therefore, I can envision myself in that job, and that's sort of what I apply for. But it turns out I'd be a fabulous manager in the maternity ward in that hospital. But I never thought of applying for that job because I don't know anyone who does that job. I don't envision myself in that job, but I have all the skills and talents to be spectacular in that job. And so the question becomes sort of, how do you predict that? And the reality is that particularly hospitals, because they tend to be larger enterprises and they have a lot of information inside of them that they may or may not realize they have the tools to do that, to say, okay, X person applied for this job, they didn't apply for that job, but they'd be fabulous in that job. And we can actually route someone into that job, which is part of what Joni's talking about. She talks about flexible roles, but just the idea of thinking flexibly about where each of us is going to thrive and breaking down the barriers that are sort of inherent in the fact that we only have the information we've got as individual human beings, but but AI systems actually can incorporate a lot more information to route folks more effectively.
The second question I had was around, and also everybody, if you have questions, put them in the chat, or we can unmute you also. The question, this whole flexibilities of roles and the remote, this whole remote environment, I'm just curious how that has affected, or how you even consider that in kind of an AI kind of view. How does that even play?
So, interestingly, I mean, I think we've all seen healthcare change pretty dramatically for a long period of time. So, Arena's been around for 13 years. So over that period of time, we've seen changes in the basic structure of jobs and the way that different departments are structured. And because we're deployed in all 48 contiguous US states, and we have such a large footprint, we can see that happening in different places around the country. So when a new enterprise says, okay, now we're changing and we're going to go to more of a hybrid work model for this particular kind of work, it would be exceptionally rare for us not to have seen that somewhere else on our platform, to be able to learn lessons from that, to be able to apply to the new strategy that, that Enterprise X is pursuing.
Got it. Okay, great, thank you. So now moving to the organization's point of view here, Joni.
Yeah, so what can you do from an organizational to have change in these areas that can make a difference? So on your refocus of communications, really create an open talent market and encourage internal mobility. Include education on what a new career looks like and what it would be like within your organization. I know we all are leaders, or many of us on this call are leaders. And you get worried when you used to get worried when your team member wanted to move out of your organization because they were really good. So you kind of hid them and didn't share how great they were with others. But honestly, that's not doing them any good. So really be open to internal mobility, because you'd rather keep them in the company or have them versus have them leave outward or leave to go elsewhere. Leverage opportunities, invest in internal opportunities with training and apprenticeships. Maybe do, internships of having them move, or a rotation program so they can see other things. Mike mentioned a lot of skill sets that I never even thought of would be good in healthcare, but think about those and, really provide training for them to get there. Involve administrative, clinical, and business leaders in all aspects of building teams, creating meaningful, and diversity measures. Engage employees through surveys and focus groups, enable analytics, offer development on soft skills and generational differences, and reallocate budgets to deploy new technologies and methods to really stay fresh within the latest trends and use that data to think outside the box.
Yeah. Mike, you had mentioned earlier the example of someone getting a CNA that was in customer service, and I know you've probably got some other examples to share. When clients come to you, do they tell you that that's what they're looking for? They're going to invest in XYZ. Do they come to sharing their training budgets in anticipation of what they're going to need to hire that, or is that some? I'm just curious how that happens, because just the examples that you were using earlier, Amazon workers to, med techs, etc. Right. I'm curious are you seeing those investments being made?
I would say that it ranges pretty broadly. The most common reason that someone comes to us is they say, I have a crisis and I need to improve employee retention. Like the fact that as many people are leaving as are leaving is a problem. I need to move the needle on that. And, obviously, since it's sort of what we do for a living, it's pretty easy for us to move the needle on that, which is why we generally will engage with an enterprise, say, okay, we're going to guarantee we're going to improve your retention by X, or we'll refund all the money. So it makes it a simple way of doing it, but it's normally sort of a retention crisis point. And then the range of pieces around that kind of lead to that question. So they say, well, I've got X training budget and I'm using it in this sort of more conventional way. How can I work with that? There's sort of a variety of different tools. We typically initially focus on just sort of the initial question of like, well, if we're sort of putting each person in the wrong place, we're not bringing in the right people in the first place, or we're not finding the right people in the first place, solving that problem has a pretty dramatic impact. And then folks seeing that impact ends up generating a broader set of engagement inside of an enterprise to think about other solutions. But the broader point of, you sort of hide somebody because they're really great, that Joni was talking about, I think have a really wide range of impacts on both retention and attraction. So, so again, whether it's Amazon or it's Walmart, they grapple with the question of what happens after a few years if there isn't a place for someone to be promoted aggressively. And, and so when you think about, X person's working in Y department in Z role, if that person has the ability to move to another job that is something that they like more, or pays more, or is sort of a promotion somewhere inside the organization, it actually makes it that much easier to hire the next person. Because that person knows there's a career here. And so it has an impact, again, not just on the enterprise's retention of an individual, but also on an enterprise or a department's ability to attract someone in the first place.
Got it. That's great. I want to back up a couple of slides, and I want to ask you a question about this slide real quick. And first of all, everybody, I just want to know these descriptors of the generations. Hopefully you didn't step on anyone's toes. This is what's just been the research, so hopefully there was no offense over here. But Mike, let's flip from a clinical to a technical systems, technical role that we need. Like I'm going to use clinical coding or analytics and data analytics kind of piece. And even just if you notice the very last lines here, it talks about our Generation Z folks being fully digital and our millennials being tech savvy and the traditionalists and baby boomers over here that are not necessarily, that are technically challenged. Is there a way to that even though it says that the skill set underlying a coder or a clinical informatics data analyst could become that even if they're a baby boomer?
Totally. I think, I think one of the interesting things about sort of generational conversations is it's super fun to generalize about each generation. Like we sort of take there, but these are really statistical statements. It's like, well, someone who sits in X bucket may be a little bit more likely to have Y characteristics. But the reality is that inside each of these groups is a pretty broad range of a whole range of characteristics. So, my parents are traditionalists. My mother was born in 1945, and my father was born in 1943. My father, his technical skills are really limited to turning the computer on and off. My mother, has like the front edge of every app you could imagine, is on every social media platform you can imagine. Fortunately, she's not posting too much, but she engages dramatically with technology, and they're within 2 years of each other and they sit in the same bucket. And so part of the key, again, that the way technology has evolved, what it allows us to do is it allows us to identify the people in each group who would be fabulous in each environment. Whatever those characteristics may be, again, there is a range. And so I think that's really where part of the opportunity is, that everyone has a range of skills and a range of talents, but inside each of these groups, it's a pretty broad spectrum. And the question becomes sort of, how do we find the folks in that spectrum who are going to achieve what we want to achieve?
So what you're saying is, Mike, that your mom could be a clinical coder if we trained her?
Yeah, although there's a whole other conversation about the people around her and what they would tell her to do while that was going on. But right. So do the therapist on here?
Yeah, right. Thanks, Mike. Moving on to total rewards. And by the way, it's 30 minutes in, everybody, just from a time check. Thanks.
Sure. So we posted all these total rewards, and they're very important, and they have changed over the years. I know I've been here 24 years, and it really looks different today than it did, even 5 years ago. But really, everyone talks about market compensation, and if you can identify people aligned with your mission versus just comp, of course, competitive is better, but it's not everything. Not everything needs to be competitive. So look for people that are, I know when we look at people, we want to know not only, is their skill set good, but, what drives them? What are their soft skills? What do they want to do? And so compensation, I know, is key for everyone, but, it really is possible to find more people that are more aligned to being at the right place and working with the right types of people. The equal pay for equal work is important, but half of all enterprises pay below median comp. So that's a very interesting statistic. And systematizing compensation creates efficiency and retention. So it's really important to have a system-wide compensation model that works. Redesigning benefits offerings, so multifaceted behavioral health programs inclusive of sessions, specialties, and on-demand access is very important. Time off and sabbaticals allow for recharging and loyalty. Portable and generous retirement plans are definitely a plus. As I'm getting closer to that age, I really focus on that more. Remote opportunities, work-life balance, flexibility, and mobility are rate very high in most surveys. Dependent care services is more important, not only for children, but for elderly care as well, as we move up and we have elderly family members to care for. And as redesign happens, really continue to review staffing levels and impacts. So I think these creative and interesting benefits that obviously they're newer. I would have said 10 years ago, I didn't see any of these, very many of these, but you can read, meditation, yoga, and GEM. We have like mental health programs that really help us in different things, through an outside service that we use. It could be, learning something new. It could be, just like how to deal with stress working virtually. You feel like you're on all the time. So we've done that as well. The microloans, debt management, and loan repayment, I think is very interesting benefit. Paid time to volunteer, return to work after leave of absence. So really trying to make the person feel very welcomed and understanding, through their leave of absence. And of course, financial education is super important, providing that. And then gratitude days. I think, if you could, give people the gratitude days because they've done or worked really hard is awesome as well. And then for development, obviously building different experiences, mentoring, support, and ongoing training opportunities are important. Just in time and honest feedback. We've all been there where you get feedback, 6 months later on something that you should have been done 6 months earlier. And it's not as meaningful as if you did it, just in time. And forward and future performance opportunities, always in the development area is important.
Great. Next polling question, everybody. Has you, here, let me shoot the poll out here. Has your organization addressed the needs of the multi-generational workforce? No. No, but the change is in progress. Yes, but we haven't seen any impact. And yes, they are effective. Mike, while we're waiting for a couple more people to comment, do you have anything to respond on the rewards earlier that Joni spoke about?
I would just underscore Joni's point about compensation. It's such a fascinating topic. And as she mentioned, half of everyone pays under the median, half of everyone pays over the median in any given geography. And so the question becomes, and we get asked all the time, well, is my retention problem because I don't pay enough? And obviously we can predict how much retention will improve for an incremental increase in pay. But the reality is that it's sometimes not quite as extreme an issue as folks sometimes expect it to be. I mean, sometimes folks are so far outside the range that is the major driver, but more frequently it's within a narrower band. And the question becomes sort of who wants to be in that environment and who wants that kind of work? And that becomes more important as long as it's within a certain sort of band of reasonableness.
Thank you. Here's the results. 60% are a yes, and it's a pretty haven't seen impact or effective. So there is motion towards addressing this multi-generation, but that's the response. Any comments, Mike or Joni, on this?
Yeah, I would say 75% is either no or yes, but they haven't seen any impact. So that's the majority.
Yeah.
And I think this is something that HR groups are, looking at different. I know, we've been doing employee surveys, and there's more coming out for our own company, and trying to really understand what's the stickiness, how are we going to keep our employees. And feedback is important. So I encourage, if you do get a survey from your employer, to really take it to heart and do it, because that's really how organizations know how they need to make change and what's important to you.
So we established healthcare, the challenges. We talked about the generations. Now let's put it together with technology and weaving AI and technology throughout this. Mike?
Yeah, I mean, I think that, that AI has been around for a while, particularly academic medical centers, I think sometimes sort of have some intuitive understandings of AI because they've been using it in clinical and research settings. But I think, if you asked folks about AI 3 years ago or 4 years ago, I think what a lot of what you would have been sort of not really understanding and fear. I think that today there's probably a little bit more of a balanced view. ChatGPT in the last year, sort of coming to the fore, I think has raised, for frankly folks in every industry, including healthcare, the point that that AI is very powerful and can be very positive, and also understanding it a little bit better so that you can avoid the pitfalls is super important. AI applied to workforce, particularly in industries like healthcare. I mean, we're primarily in healthcare, but industries like healthcare that are so dependent on individuals providing services or providing care or interacting with someone who's receiving care or services are so critical when you think about how AI can impact how we put organizations together. I think most of us understand that the sort of traditional labor market based on resumes and interviews doesn't work that well. That we don't necessarily hire the right people, that even the best interviewers among us, let all kinds of bias slip in to the way that we make decisions. And that bias is based on our own individual experiences. And AI provides the opportunity, when paired with a person, provides the opportunity for an individual a human being to do what they're good at, and data and technology do what it's good at. And the pair of those things together can actually massively reduce bias in how decisions get made and improve how the decisions get made from an outcome perspective. But that requires sort of an understanding of how the pieces fit together and how to adopt that.
Yep.
So I think that there are a whole range of use cases when we think about AI applied to workforces in healthcare. Obviously we've talked about the movement of folks across industries. If you're like most people, you think, okay, I'm looking for X in someone's resume, and X involves working in healthcare before. So if someone hasn't been working in healthcare, I mean, this problem's existed with folks leaving the military forever. Because like a resume for someone in the military doesn't necessarily translate into sort of the private sector world. But that same problem exists across industries, where you say, like, how as if I'm a hiring manager in an acute care provider, how do I figure out if that person who does not have a resume that I'm used to seeing is going to be good at my job? More generally, how do I know if someone's going to be good at my job? How do I know who I should be promoting? Yes, I've worked with someone, but what if actually the appropriate promotion trajectory is not inside my group, as Joni was talking about? How do I think about who's working in security, who'd be an incredible nurse? So I know that that's a productive investment. How do I think about, most healthcare providers have pretty diverse junior staff and pretty not diverse senior staff. And so the inclusion problem exists pretty dramatically. How do I think about that? How do I think about who to identify among my more junior ranks that I can move into a more senior way so that my total workforce looks more like a community unit? And even stuff as basic as, I've got a big enterprise. How do I figure out which unit inside my enterprise, which department, which hospital inside of a many hospital system is doing something different? I can see a financial result, although that's a trailing indicator. How can I see when someone has a slightly different culture and whether that's a culture I want to replicate or that's a culture I need to intervene and do something about?
There's a comment in here that talks about there's a comment on your statement, Mike, that says, even though AI may eliminate biases, the final decision in hiring is done by a human.
Yes. Yeah, when I talk about pairing AI with a human, that's what I'm talking about.
Mm-hmm.
There's this sort of like wonky AI research world had done some research a bunch of years ago, testing whether a person alone, AI alone, or a person and AI together were more likely to pass the medical boards. And the answer was a person and AI together are more likely to pass medical boards. That's a simplistic application of this idea. But the reality is pairing the two together so that each can do what it's good at, generate a better outcome. And just not to be too nitpicky on syntax, but AI will not eliminate bias. AI can reduce bias, but eliminating it is a different story. And I know that's a subtle, but it's a very important distinction, I think, when we think about how these pieces fit together.
Mm-hmm. Great. Thank you.
So, I talked about this a little bit. I could just sort of hit on a couple of the benefits, obviously just from a sort of basic operating perspective, the idea that, that things like AI can massively shorten time to hire, can significantly improve retention, can increase applicant pools in a whole variety of ways, I think are really key in terms of understanding the operating impacts on particularly in healthcare, where there's such complicated enterprises and they're so dispersed and centralized at the same time. The risks often come around how do you adopt stuff, right? I mean, most healthcare providers have been overwhelmed with adopting new technologies and have had a whole range of success in adopting them. And so things like how do you acquire technology? How do you adopt technology? Require attention that I think sometimes enterprises don't apply to it. And as a result, they aren't able to maximize the value of those investments. And I think obviously we all recognize, because there's certainly been a lot of public discussion about it, this question of bias. Whereas if bias isn't, if the technology is not built correctly, it has the risk of institutionalizing biases that already exist. And so, you're just gonna, further embed problems you already have if it isn't dealt with correctly. And obviously part of the skill of acquiring technology is in understanding who in a partnership between a technology provider and a healthcare provider should own which risk. And so, obviously my job is in the business of like deploying technology. But often what we say is like the risk, you should put the risk on us that the technology is not built correctly. We should be able to indemnify you from these risks, because that is a key part of understanding who owns which risk. And, and the reality is if you run a hospital system, your skill set is probably not an understanding of how to look under the hood of an AI system.
Yeah. Great, thank you. We've got 15 minutes left, just a heads up. Mike?
Sure. So this is data from our platform, which I mentioned is 2.8 million people across the US, increasing by about 600,000 a year. And really what this is reflecting is as these technologies are adopted, we see very dramatic impacts on operating metrics. And obviously we're just one example of this. There are, an increasing number of examples of AI applied in this space. And so obviously, I know the one that we work on the best, but we're not the only ones who work around this area. But I think what this underscores is, frankly, just how impactful these technologies can be. I mean, at a 30% adoption rate, so 30% of hiring managers are relying on this technology for support of their hiring system, you're reducing turnover by 27%. Like, that's a lot. And, and there obviously are serious economics in it, but there are also very serious impacts on the way care is provided. And so, this is really just to underscore, and this is across every, this is across every client we've got, every person on our platform. So you're talking about very consistent results, even at lower levels of adoption.
There's a question in here that says, are you seeing change management programs and practices being integrated more frequently today to address these challenges?
Yes, but I would say there are a range of them. I'd say that more often than not, those change management programs are relatively weak. And that becomes sort of where the challenge percolates up. That, and there are all kinds of reasons for that, but that sort of spending some time focusing on the sort of change management piece of things is a very relevant part of how to make sure these things are successful. So here's some other data from a single hospital system. And so this is just an example of, deploying this technology. This was a client that, in a 2-year period, got 550 experienced RNs who were not otherwise in their applicant pool, weren't otherwise known to them, who were likely to stay in jobs in their enterprise, who were basically delivered to a hiring manager in that enterprise using AI. And so, obviously that is very impactful given the perception of a shortage of experienced RNs, that, that an enterprise, by deploying a piece of technology, could get this many experienced RNs just from a piece of technology like this in that period of time. And that by optimizing for folks who will submit more applications or who might actually not necessarily be the right fit for the job they applied for, that you can effectively increase an existing applicant pool as well.
Great.
And this is another case study, 20,000 employee hospital system in the Pacific Northwest, that again used this technology to improve retention, and saw again a pretty significant, very significant retention improvement. So going from 33% to 21% is a big deal. Again, in this situation, holding an AI vendor accountable for an outcome is less frequent than I would expect. And our suggestion to our clients is, you should hold us accountable, right? If we're saying we're going to improve your retention, we should improve your retention. And so so we typically will provide a guarantee, but but when you're looking at vendors, I encourage everyone to think about what you expect of that vendor in your commercial relationship, to ensure that the entity in the relationship that knows the most about that thing is accountable for that thing.
Great. Last polling question, everybody. Here, let me launch it. Have you considered AI in your talent acquisition strategy? A, no, it's not in our budget. B, yes, it's not in our budget. C, yes, we have budget, we haven't started. D, yes, we have budget and have selected our partner or partners. And E, yes, we are done and we have proven success. I need a couple more people. Thank you. Great, thanks. So there is some with budget starting and no, right? Really just between that. So really early on in the whole talent acquisition AI space of this endeavor. Great. So as we wrap up this key takeaways, I wanted to kind of open the mic to Joni, and then we'll move to Mike to kind of give us your thoughts or takeaways that you want folks to leave here with, or comments that you want to make, or observations. So we'll go ahead and start with Joni.
Thanks, Kenan. So, every single candidate you consider will be different. So personality, culture, experience, and background are all completely individual. But humans have some shared traits that, when cultivated, help them become better versions of themselves. So remember, one size fits all does not work in attracting and retaining a multi-generational workforce. Flexible programs, rewards, and fairness is the key. Gig workforce is on the rise and desired by many. So by using this workforce to ease your shortages and increase your skill set, this should really be part of your strategy going forward. As Mike spoke about, use of AI and technology can be very impactful, and we are seeing this in some of our clients as well. Lastly, we know organizations have a lot of data about their employees that they could leverage for their benefit, i.e. for the multi-generational population, especially the baby boomers and traditionalists. You can utilize their entire experience of an individual and not just the last few years. And this is our secret sauce at our RGP with our employees. We get to know the whole person and are able to deploy them to help our clients. So thank you, Kenan. I'll turn it over to Mike for his key takeaways.
Thank you again. Thank you, Joni. Thank you, Kenan. Thank you, everyone, for being here. I think, just to underscore some of the points that Joni just made, that technology has evolved a lot. I think we will get that in an abstract sense, but the reality is that the amount that technology has evolved makes it possible for us to solve problems that we thought were just part of the cost of doing business. And that is incredibly impactful. And one of the other pieces to keep in mind is when we think about sort of the broader restructuring of healthcare in the United States and beyond, but the broader restructuring of healthcare and the entities within which healthcare is provided. One of the questions that we've been asking for a long time is, what is the purpose of hospitals? There have been incentives to move things out of hospitals. There have been incentives to create new entities, to move folks out of hospitals into new, more nimble entities. The reality is that a large employer has a competitive advantage in an environment where data is valuable. And so a large employer, which often starts with some form of hospital system, has an advantage because there's so much data inside that platform. The question is, how do you leverage it to create that value? And that these technologies create an opportunity for healthcare providers to sit more competitively, in a given geography or nationally, in a way that allows them to move operating metrics that improve financial performance, to move operating metrics that improve care, and to sort of transform how they are doing business. But it does require a recognition that these technologies are here, and these technologies are powerful, and they may be a little scary because they are new, but they are so powerful that if you are not engaging with them, you're at pretty significant risk of falling into a worse competitive position.
That's great. Well, thank you very much. We are 6 minutes before the top of the hour. We can open this up for Q&A. Questions have been coming through the chat. So if there's anybody have any other questions or comments, you raise your hand. I can also unmute your mic. Okay. With that said, everyone, thank you very much for your time. If you need more information, you can email us at partner@rgphealthcare.com. You can direct those questions. We can get them to Mike too, or Joni, or any one of our SMEs. So we thank you very much for your time. And everybody oh, wait, there's a question. Oh, great session. Thank you very much, everybody. Have a great day.
Thank you.
Thank
Thanks,
you.
Kenan. Thanks, Mike.